Ray Suarez has more on the Mexico story.
And for that, we go to Mexico's ambassador to Washington, Arturo Sarukhan. Mr. Ambassador, welcome.
Thank you, Ray.
Are you getting new cases, either suspected or confirmed, at the same rate as you were in the last several days?
No, given the information that we're getting from Mexico City and that the health ministry is reporting, there seems to be a slowing down both in the rate of infection and also in the rate of deaths related to the virus. So there seems to be a leveling off, but I think the next 24, 36 hours will be critical to determine whether this trend is sustainable.
What about geographic spread? Have there been outbreaks in all the Mexican states, or are there some parts of the country that are more heavily affected?
No, so far there are 12 states in Mexico where we've seen outbreaks. It is heavily concentrated, though, in Mexico City and in the larger metropolitan area of Mexico City for obvious reasons of concentration of population.
Suspicion is now turning to the state of Veracruz, where there are some very large factory farms producing hogs. Are you getting some assistance in tracking it down, in inspecting these farms from international agencies, or so far is Mexico trying to do it on its own?
First of all, we're still trying to ascertain where this could have originated. It is not clear that it originated in Mexico. We're trying to determine this with Canadian and U.S. medical and health facilities. There's a very important story that has to be put on the table, Ray, which is that Mexico, Canada, and the United States, back in 2005, understood the challenges of some of these diseases, global diseases. And since then, we worked together to ensure that we had the protocols, the exchange mechanisms, the cooperation mechanisms to be able to tackle these issues. So there are members of CDC working actively in Mexico with health ministry officials to try and pinpoint where it could have started and the rhythms and methods of contagion.
Have you been able to determine that the people who've been identified so far as having died from this flu, in fact, died of it? Have you been able to analyze blood samples quickly enough? Have you been able to analyze, do post-mortem examinations quickly enough to know whether, in fact, someone has actually died of this outbreak?
From the moment that the Mexican government identified that we were dealing with a new strain of influenza virus, the Mexican government has moved very quickly and very effectively to determine and pinpoint what's going on. Of the 140-plus deaths that have been registered in Mexico, so far the latest number that I saw is that 22 are directly related to this specific strain of influenza virus.
But so far, if someone has something that looks like it, you're going to work on the assumption?
We are going to work on the assumption that it has to be contained and it has to be treated effectively and quickly.
There's already starting to be some criticism about the speed of the government response. Some of the earliest cases at the beginning of April, the government, it's said, didn't move quickly enough to notify Mexicans that there was a problem, that perhaps they could limit contacts, that the people around those who were affected early needed to be treated with prophylactic drugs. What's your response?
The Mexican government responded very aggressively, very actively, and very transparently the moment we determined that we were dealing with a new strain of virus. Remember that when we registered some of the first cases at the beginning of April, we were at the end of the flu season in Mexico in general, so there may have been at the beginning a bit of confusion whether this was something new or it was part of a general pattern of flu that we have seasonally in Mexico. The moment we identified that we were dealing with a different strain a week ago, the Mexican government immediately notified Mexican public opinion, immediately took steps to try and contain it by suspending schools, by suspending soccer matches over the weekend. It has very aggressively and very transparently moved to tell Mexican citizens what is going on and to try and ensure that we can contain and then treat those who have fallen ill.
With each new day, as you mentioned, new restrictions come up. The closure of restaurants, the closure of movie theaters, the discouraging of large crowds. How do you strike that balance between the needs of such a large country as yours, of people to get around and do business and do their lives, and the need to contain the spread of this disease?
One of the most effective instruments that we have, that public health officials worldwide have to contain these types of diseases, is to very quickly try and mitigate and isolate the factors that allow the virus to propagate, and that is social gathering. So one of the things that we've done very quickly to prevent a larger spreading of the virus is to try and curtail social activity. But number two, I think the paramount consideration for the Mexican government is to ensure the well-being and the health of its citizens. And if this entails that there will have to be some curtailing of activities that are normal to the life of a 20 million city like Mexico City, it has to be done because paramount is the health of our citizens.
Let's talk about the economic impact. Mexico already was feeling the downstream effects of the American economic downturn. Add to that tourism problems that had to do with the adverse publicity coming from the drug wars. Put this on top of it, canceled weddings, people canceling their flights, hotel reservations. This could end up costing your country a lot of money, no?
Certainly, but more important is the health and well-being of our citizens and our ability to work with other international partners, with the World Health Organization, to ensure that we can control and shut down the propagation of the virus. That is our priority.
How will you know when it's okay to open up again? And will people believe that Mexico's open for business once you say it's okay, it's safe, come back?
Well, I'm sure that when we are able to do that, it will be validated by other countries that are working in close cooperation with Mexico and by the World Health Organization. I don't think that Mexico would try and portray a situation which does not exist, and when we do so, we will do it with the facts and in a very responsible and transparent fashion.
Is there anything that you still need at this point? Has the WHO, has the Pan American Health Organization, these organizations that exist for just this kind of emergency, been called upon by your country?
Yes, and they're working actively not only in testing, but also in trying to determine how the virus is propagating or could propagate. We have CDC health officials working right now in the field with Mexico. Mexico is sending samples of labs both to the World Health Organization and to US and Canadian laboratories. So I think that this is the third premise on which we have been working since the outbreak, which is to ensure that through international cooperation, we are working to shut it down.
Are you getting advice on just how long it's possible to restrict the movements of a place like Mexico City with more than 20 million people? At some point, people are going to want to move. They're going to get cabin fever. There'll be more casual disregarding of the rules. If you keep people out of each other's way for a while, can you suppress the disease enough to start lifting the restrictions?
I'm not an expert on public health, Ray, certainly, but I can tell you that in this case, there will be two critical denominators: common sense and the medical data that is being analyzed by health authorities in Mexico and worldwide that will allow us to determine how quickly normalcy can return to an urban center like Mexico City.
Ambassador Arturo Sarukhan, thanks for joining us.
Thank you, Ray.